Hi, my name is Stephanie Morris. Today we're here to discuss deep vein thrombosis. Today we will cover the pathology, formation, treatment, and prevention of deep vein thrombosis, or DVT. First, let's discuss who's at risk for developing a DVT. Those that are in a hypercoagulant state, for example, like cancer or pregnancy. Those that have had trauma or damage to the vessels. Additionally, those that experience venous stasis, those that are bedridden and not mobilizing and moving. And also there are some people with a genetic component that predisposes them to development of clots. So let's talk about exactly what a DVT is. And it is exactly what the name says it is. So let's talk about the thrombus. So blood cells travel through our circulatory system and then clump together to form a thrombus or a clot. And those continue to grow. Sometimes they adhere or stick to the side of the vessel wall and keep growing and then block blood flow to the distal extremity and preventing blood flow up through to the heart. What happens once we've blocked blood flow is that it backs up into the legs or that extremity and prevents blood flow. When that happens, it can create a lot of pain. And this is usually when patients present to the physician or provider, is when they start to complain about swelling and pain in that extremity. Once the provider has determined that they are at risk for a DVT, and they indeed suspect they have a DVT, they'll perform an ultrasound of this area to examine the blood flow. Additionally, they can perform a blood test called a D-dimer, to look for the presence of clotting factors or fibrinogen in the bloodstream. After they've determined that there truly is a clot in place, they will begin treatment. So depending on the condition of the patient and the severity of the clot is to what treatment will be appropriate. So they can do a heparin, either sub-Q or IV. We can also do a warfarin therapy, and there are some oral anticoagulant therapies as well. They will choose what is best for the patient. And in some severe cases with a thrombus where they want to use a thrombolytic and break it up, they won't give it systemically, but they will use a catheter and guide it into the vessel and inject the thrombolytic agent directly into the clot and help it break up. So besides the problems that DVTs can form and prevent blood flow to that extremity or leg, the other concern is that it could dislodge and then move upstream into the blood vessels all the way up into the heart and then be injected and pushed into the lungs, causing a pulmonary embolus, which can wreak havoc on our respiratory system and in some cases even cause death. So prevention is key. After patients have experienced a DVT, they're at higher risk to develop it again, because the blood vessel is now damaged. And remember when we talked in the beginning, blood vessel damage or trauma predisposes you to a deep vein thrombosis. So after a patient has experienced that, they will need to wear things like TED hose to provide compression to prevent the blood vessel from expanding out. When patients experience procedures where they're on an OR table and very still for a long period of time, they'll place sequential compression devices to help mobilize the blood and prevent venous stasis. Additionally, sometimes even when patients after procedures will take an anticoagulant therapy to prevent formation of a DVT after their procedure. There are over 10 million cases a year for DVTs, and that many of them could be prevented with some of these therapies. Thank you, and have a good day.